Great. Welcome everybody to May's Swipe session supporting Campus Pantry period product access. I'm very excited. We have a great conversation with us today. I'm Jillian Kieran, the director of programs here at Swipe Out Hunger. And with us, I have a very fun guest speaker. Ellen, if you want to come off mute for a moment and just introduce yourself to the group.
Sure. Hi, everyone. I'm Ellen Cynar, and I am head of operations and partnerships for Unicorn. We are a Massachusetts-based women-owned period care company, um, improving the bathroom space, but also improving the community distribution space. So I'm very excited to be here to talk with campus pantries and talk about access on campuses today.
I love it. Thank you, Ellen. So, brief overview of today's agenda. So, we're going to start about what is period poverty insecurity overview, followed by student impact, some tips and tricks, and then I'll introduce our other panelists. We'll do our normal Q&A, and then end out with some resources and a fun little raffle event. As we were saying in all of our outreach with this event today, Unicorn is graciously donating 2 bulk orders of menstrual products to participating campuses. So at the end of today's session, we are going to raffle off one directly in the session today, and then we're going to raffle off one more tomorrow. So thank you all for participating with us. We're going to have a great discussion, and then you might be lucky and win a bulk order for your campus. All right. So what is period product insecurity? Period product insecurity is also known as period poverty, which is the limited or inadequate access to period products or menstrual health education. Ultimately, this is critical issue to education, health, and well-being of students. For some fast facts, 1 in 10 U.S. college students experience period poverty. 1 in 3 low-income women report missing work and school due to a lack of access of period products, and 0 period products are covered by public benefits like SNAP or WIC. However, there are some states that are trying to address this through mandated period product placement directly in their different bathrooms, in different institutional restrooms, anything of that kind of sort. So some states, specifically Washington, California, Illinois, DC, and New York, have implemented policies mandating period products in their higher education institution bathroom. This leads providers to navigate broader basic needs with limited budgets. Specifically, you could check out this QR code here in the bottom corner about tips on compliance with this. We do want to state, though, that with this, it is a big help with it, but it is only a small factor that can address this need when it comes to period product mandation and period product access as a whole. And so there's much more work that can be done and should be done surrounding this topic.
All right. So I will also add to what Jillian was saying about those mandates. This is sort of the hill that I'm going to die on as someone who thinks about period care access all the time. Bathrooms do not solve period product insecurity. Bathroom bills are super duper important for people who need access to period products while they're in the bathroom, right? And the analogy I often give is, many of you, you're all thinking about food access. You would never say to a student, please go to the cafeteria's vending machine and think that you are going to get all of your food needs from a free granola bar in the vending machine, right? So that's sort of the equivalent that I often try and use. So bathroom access is for everyone who needs products while they're in the bathroom. But for those of you who are thinking really holistically about a whole student's need or a whole campus need, that's where the pantry is super important, because all of these things that you're thinking about in terms of the students, like all their needs, it's not going to come from a single source as a one-off, right? So a lot of the impacts of period product insecurity are very similar to food insecurity, right? It's impacting students' health, it's impacting their academic achievement. We talk a lot about what happens when you don't have access to a period product. And so you wind up using what we call proxy products. So that could be wadded up toilet paper. For many people, they're using cotton products that they have at home, socks, things that sort of are proxy or akin to what a period product could be, but are certainly never going to be hygienic or actually serve the actual purpose of a period product. Or someone isn't changing them as frequently as they should. There are recommendations on how often you should be changing your period product. That's really important to a person's health. And so people will try and extend that out, which is not good for them. Absenteeism, again, this is very similar to food access. People are skipping class, they're skipping work, and they're really skipping the things that are important to humans, right? Like sports events, social activities, faith based participation. Um, if someone is period product insecure, they're deprioritizing their other basic needs. So it's all this sort of like economics of trade offs, right? What am I moving around so that I can afford period products, or what am I doing to stretch it out? And then I think the thing that stands out in terms of an impact for a college student, the mental health piece is absolutely true for food access. But when you think about period product access, it's even more compounded. There's massive stigma around periods, around menstrual health. And so you have a lot of self blaming, like, oh, I don't want to talk about this. I don't want to like let people know that I don't have, the money to buy a product. And so that's often managed invisibly in addition to all the other compounding issues of not being able to afford food or adequately afford all of your other basic care needs. All right. And so, again, those barriers to access are that, students are having to make trade offs. Am I going to afford period products? Am I going to afford the other things that I need? Often these are being made at a household level too, right? So, for many of your students, they're caregiving for other people. And so they might not be a person with a period, but they might be caring for someone that needs a period product. And so, what are the trade offs? Am I not going to eat so that my child or whomever I'm caring for who needs a period product can get them? And so those trade offs are happening, and I think it's a good reminder too that just because the trade off is happening, it might not be for a person with a period, but they're making those trade offs on behalf of their household. Um, there's the access barriers. So maybe there aren't products in the bathroom. Maybe there isn't privacy in order to change your period product. And then just sort of the inconsistency that I think we'll talk about at the pantry level when there are potential to provide period products. Um, but I think we're seeing a change, which is really exciting. And I think, it starts in these spaces that you're all sitting in. It starts in these spaces where you have advocacy opportunities. And we're definitely seeing, especially with sort of post COVID, the the realization that hygiene products go hand in hand with food insecurity or food needs, and that there are certain products like period products that actually need to be called out, which is why we're having this conversation. All right, so here's the like want part. So you all are living in constrained funding opportunities, constrained resource opportunities. My background is in public health. My background, I've worked in nonprofits, I've worked in local government, I've been in your space. I know these pains. I know what it's like to be grant funded. I know what it's like to live and die by the next funding opportunity or person who has some philanthropic endeavor, right? And so we are seeing this move toward the inclusion of basic needs products in grant opportunities as a call out in companionship to food access. But many times, period products are not called out, or there's really no dedicated funding specific to period products, even though about half the population at some point is going to need a period product. So these are sort of my personal tips and tricks. Um, it's a dance, and I think a lot of it has to do with being really creative about how you think about period care as part of your broader basic needs access. So my first tip is really think about how to frame the need, right? And you're all probably very creative at patchworking and messaging and how you're funding your basic needs pantries and hubs. But going back to what are the impacts, right? Like, how can you frame it within the impact? Are we dealing with chronic absenteeism on campus? Is this an issue of, maintaining or keeping students on campus? What are the themes and the things that funders are caring about, and how can you sort of reframe period care within those within the things that they're caring about? Um, like I mentioned, period care is often left off that laundry list of essential basic hygiene needs. It just is. And a lot of times funders are very clear, like you cannot go outside of the allowable expense. And so what I always recommend is please, please, please go back to your funders and ask them if you can include it or note that it's not included. I would say in a lot of cases, funders are just like, oh my gosh, I can't believe I didn't call that out, right? Like there's a lot of like, oh, aha moments. And a lot of times they'll make those modifications. You got to collaborate. I'm sure you all have creative collaborations across your campus with other departments. Um, but that's how you can sort of consolidate. I think, a lot of times period care is often shared with health services, nursing. So think about who are your buddies on campus who can be your companion procurement friends. And then, uh, it's never too late to beg and borrow and steal from other departments who are trying to spend down money. You lose it, or if you don't use it, you lose it. And so, period care can actually be one of those like very quick spend downs for budgets that are sunsetting.
And then I'll just add this. You can go ahead and scan that QR code at the bottom to check out the Hope Center's recent article on different federal funding opportunities that might be able to address this issue.
Yeah. And I will add too, sorry, I have lots of thoughts about funding.
Please,
One
Ellen,
of,
go
yeah,
ahead.
yeah, okay. One of the big recommendations that I'll make, and for those of you who've ever worked with us and partnered with Unicorn, um, start a conversation with a vendor. Start a meaningful conversation with a vendor. Get to know how they operate. Let them know how you operate, because a lot of times these sort of relationships can be um, very dynamic. So, for example, we work with a lot of pantry partners who are applying for funding. We will be out there writing letters of support for you. We will run projections for you. We will stuff a budget as much as we can for you. But we're only as good as we know what your needs are, how you operate. And so having that relationship and finding, and that's true for most hygiene companies, right? So it's not just saying, and I've been on both sides, but it's not just saying, hey, can I have a donation? Saying, hey, can I have a conversation? This is where we are. This is who we are. This is who we're serving. All the pitch things that you all know how to do. But think creatively as a partnership with a vendor in order so that they're your top of mind when they're thinking about opportunities as well.
Great feedback, great perspective, Ellen. Thank you for sharing from the distribution kind of aspect of it all. It's how can that conversation continue and improve ultimately. And so moving on to our panelist section. So I'm very, very excited. We have Jamie here. Jamie's actually our CEO here at Swipe Out Hunger. Jamie, if you want to come off mute for a moment and we'll get started with the conversation and Q&A.
Thanks, Jillian. And Ellen, thank you so much for these insights today. I really do appreciate. I was jotting down some notes while you were talking. I was like, oh, I want to talk to Ellen about this. I want to talk to Ellen about this. So Jillian's going to frame it up with questions, but just so everyone knows, I might go rogue. Apologies in advance, Jillian.
I love
Uh,
it.
Jillian put my formal bio here. As it mentions, I am the CEO of Swipe Out Hunger. I've been here for about 4 years. And I live in Boise, Idaho. So we had a fellow Idahoan that was going to be a panelist with us today, Emily Hester at Boise State University, who I work closely with here locally. But unfortunately, she's not feeling well. So I'm going to try and represent some of the amazing work that she's done in partnership with Unicorn on her campus, as well as bring in a couple of different perspectives from my past lives. So thanks for letting me join you all.
I love it. Thank you, Jamie. And then I just wanted to include Ellen's little bio here as well, too, as part of the conversation, so everybody can get to know her a little bit more as well.
Yeah, and I would say my background, I think what's really special about this partnership that we have with Swipe is my like OG public health work is in food access. And so wherever I can see the marriage and the engagement of food and basic needs that are, it is not a, they're not exclusive conversations, right? They play off of each other and they all have to do with dignity and quality. And so it's always a privilege when I get to be in conversations around food access that are also including hygiene products.
Food is the gateway to all basic needs.
Mhm.
That's what we say. You can't separate out housing, mental health, transportation, childcare, hygiene products, right? All of it is so interdependent. And if you have, uh, I hate the term comorbidity, but if you have an insecurity in one area, chances are your comorbidity is high in other areas. And so we like to think of food, while food is our specialty at Swipe Out Hunger, we're a champion for all of the basic essentials.
Love it. I love the discussion happening already. So, as always with our swipe sessions, or if this is your first one joining us, please feel free to share your thoughts in the chat while the panelists are discussing. If we have time at the end, we do have that beautiful raffle to get to. So, hopefully, we'll get to have some time to open the floor up for further questions. But also, already looking so excited to seeing what questions Jamie has already come up with for
Careful, careful what you wish for.
So to start off, I know we started kind of touching upon it already, but I want to just formally ask, how can organizations design period product programs that are sustainable, accessible, and responsive to community needs?
Yeah. So I would start off with saying, assume people need and are using period products, right? That's just baseline. A lot of times when I get into conversations with folks, like, oh, we've got a survey. Are people actually people are having periods? Like, you can assume that half the population in the world had, is having, or is going to have a period. And so once you get past that, like, is this even a need? Then you can get into like, what is the need? How is the need going to be addressed? And how can we have a role in that? A lot of times, particularly in bathroom access conversations, it's people spend so much time trying to survey, like, do people even use period products? And it's like, just because you don't offer it doesn't mean that people aren't still having periods. This isn't an opt-in experience. It's not an on-off switch when it doesn't exist, right? It's the same for toothpaste. People still need to brush their teeth even if they don't have access to a toothbrush. um, so moving to that sort of assumption model that you are going to have a need and that it's probably pretty quiet, right? It's not, this is still a taboo conversation, even in the United States. There's a lot of stigma around it. People have very different experiences with their periods, how they talk about it in their own communities. And so I would say staying kind of high level in how you want to engage with folks around period care. You still want to be surveying sort of what need or getting a pulse on what product quality or product interest is, but not making assumptions, right? You don't want to be assuming who has a period or who doesn't. We talked, I talked previously that there might be, say, a father figure who is not having a period, but has a child within their household who is having a period, a spouse who is having a period. And so thinking really sort of whole family and not trying to sort of drill down to like, what are you doing? What do you need? Um, and then I think, starting sort of small, starting with some pilots, starting with some, hey, how does this work out? Is this the type of products that folks are looking for? One of the blessings now in the retail space is there are so many different options of period care. That's a great thing. But it can be very overwhelming. And so starting with a few products, getting a sense of what the demand is and how people want to receive the product, who, to the level that you want to be sort of understanding who's taking or who's using the product that you're offering. Um, but I think the consistency is really important. And I know this, it can be very hard for many pantries that are offering a new product or trying to maintain a product that isn't obviously fundable. It's the consistency piece. And so how can you start in a consistent way where pantry participants, hub participants, people coming through are going to know that it is possible to get products there and get them consistently. Um, Another hill I'll die on, you are not bathroom experts. You are not janitorial and facility experts. Again, there is a big difference between what happens in a bathroom on a campus and what you're supporting for holistic whole student experience. I think that pantries can do an amazing job informing bathroom distribution, but they are separate, right? You are thinking about how do I support a whole month of products for a student versus a one off in a bathroom. And that also gets to the quality piece that I think pantries have an amazing ability to help respond to. And that again is what are participants actually wanting? I will always say nobody wants your expired dinged can of tuna, which means that nobody wants your really low quality period product. So really thinking about the quality of products that you're trying to give out or make available in the pantry space is really important. And that goes back to dignity, that goes back to health, and that goes back to quality.
If I could, first off, happy National Tampon Day.
Woohoo! Ding! It's National
Perfect
Tampon Day,
timing.
everyone.
Love
Perfect
it.
timing.
I forgot. When I came on, Ellen was like, it's National Tampon Day. I was like, oh my gosh, we should celebrate that.
Yep.
And I want to elevate a couple of the things you said, Ellen, because I thought of this in a similar fashion. I have a tendency to oversimplify the initial and then build in the business plan later, right? So when I saw this question, I immediately thought of, oftentimes we talk about food access as food access today, tomorrow, and then hunger. How do we solve hunger forever? So I put those things in three categories. And earlier, in our introduction, you touched on like emergency access versus regular access versus sustainable access. Like, how do we put ourselves out of business in the sense, right? And you so eloquently put this in of like what happens in the bathroom, that's emergency access, right? I didn't know my period was coming today, or I didn't bring enough tampons with me or period products in general with me. I just need something right now so that I can focus during class instead of going home, right? And then you've got regular access, which is my pantry or a local community benefit organization supplies me with, consistent enough access where I can supply for myself or for other people in my household. And then the sustainable access is where, Unicorn has done some of the reflections and support around the legislation.
Mhm.
Jillian had that map up of here's the states that have passed higher education specific legislation, and you saw that it was only a few, but there's 27 states who have passed legislation for federal institutions or other institutions outside of higher education, as your article
Yep.
states. So there's
Yep.
already a culture of understanding. How do we also include higher education in that, right? To have the sustainable access long term in
Yep.
an emergency status, but then also, is it living wages, right? Is it how do we give ownership back to the individual and their household to make the choices that they need for them? That's that bucket of
Yep.
sustainable access that I don't think very many of us talk about frequently enough because we're just trying to survive in the emergency access world.
Yep.
So
Yeah.
thank you for touching on that. That was helpful for me to see.
Yeah.
Sorry, did
And
you
I
want to?
No, I think you're right about the long-term access. And I mentioned there are so many period products out there, right? It's a very personal thing. And what I
Yeah.
use today in this hour might not be what I want to use tomorrow or need to use tomorrow, right? And people don't just use one type of product, they use a mix, not mixture. They use like there's a whole, I might use a cup today and tomorrow I know I'm going to be out and about and I'm just going to use tampons, right? And so people are interchanging the product types, and that opportunity of choice is really important. And I think it's hard because the pantry can't solve for all of that, right? Like you're not going to look like you're not going to look like a CVS or a Walgreens. You're not going to have all of these products. You're not going to be a direct to consumer um, campus pantry. Um, and so really trying to make sure that the core products that you do offer are sort of meeting the quality needs and the dignity needs, I think is really important.
I also appreciate that you were like, and don't get stuck in analysis paralysis, right? Like don't over survey and under try, right? These programs and these pilots. And one of the things that Boise State does that I really admire is they do have a variety of period products. Granted, nobody looks like CVS, right? But they partner with Unicorn to have pads and tampons. But then they also partner with a local community benefit organization to have reusable, washable pads. That obviously is unique to people who have access to a washer and dryer, right?
Yep.
And which is not all college students. But having that option and accessibility for sustainability, right? Like I can reuse this washable pad, month after month is such an opportunity for folks. So when you said create a relationship with vendors, I also was like, yeah, and there's other CBOs in your neighborhood that are probably willing to support you in this, whether that's with funding or with products themselves. So I love that you
Yeah.
called that in.
Yeah. And we are super supportive of reusable products. I think that's amazing. And I think that again, people are using a combination of products. And so I definitely know the reusable space. They are relationship based. So please reach out to them as well.
I love this. I love this conversation that we're having already. And I think it leads to a great next question. As we're talking about sustainability long term with it, what gaps are still existing in these conversations around menstrual health and basic needs support? And how can we address it past what we were just discussing with it?
Yeah. I think just having conversations like we're having right now is step one, right? We're normalizing a basic biological process. We're normalizing that people use period products to manage periods, menstrual hygiene. Um, I think, for many of you who have college students or higher ed students that are coming from the K-12 space, like Jamie mentioned, 27 states in the US require period care in some form in K-12. So a lot of the students that are entering into higher ed are already coming from states and schools that were
Mhm.
already providing period care in bathrooms. And so there's kind of this interesting expectation or assumption that a lot of college students are already coming in with because of their K-12 experience. But they're now coming in and they have to provide their own basic needs, right? Or they have to sort of manage that on their own if they haven't been managing that on their own. And Snap and WIC aren't going to cover that in any way. There's no sort of like help button on that space. Um, and so I think some of the gaps that I see are really, again, awareness, understanding, people not understanding that periods happen every month for the most part. This isn't like a one off thing where we gave away toaster ovens. It's like this is a monthly need. And that's a funder issue as well. A lot of times we'll see funders being like, oh, well, we'll just do like a 1 month supply. But it's like, well, we need this every month, right? So it's a reoccurring product need, not sort of a one off product need. Um, and then I think an opportunity too, and this isn't to say that this is where the pantries or basic needs hub leaders should be, but there's a big education gap around periods, right? Like I mentioned. And so really thinking creatively about how you can, and this is not to say that you are supposed to be a menstrual health educator, but how can you find your community benefit organizations? How can you partner with your nursing teams? How can you partner with your health educators on campus to bring that in and really bring a value add to what the pantry is going to be? That does not mean you have to be an expert, but how do you find the experts in your community?
I love this. It made me immediately jump to some of the language we use in this arena. Unicorn, you all do such a great job ensuring that anyone who has a period, regardless of gender identity, right, any of that, is it's your fault. This is for anyone, right?
Mm-hmm.
And
Yeah.
so I applaud you for that. And it also makes me think about who are the audience? Who's the demographic that the campus serves, right? Are there religious, cultural, traditional needs around menstruation products that need to be taken into consideration. And, you know, this is where I'm woefully undereducated when I think about, um, uh, you know, should folks be coming to school or coming to work, right, in this situation? Again, what's their cultural, traditional, or religious expectations during their period? And I'm curious, I guess, more than anything, I pose that of like, you know, here we are in this space and still lacking education, right? Still lacking that knowledge and awareness. So I'd love to see more narrative story studies or cases that can allow us to see and connect the dots around making this more accessible. Earlier, you touched about stigma. And when I think about food, I get pretty jumpy around the word stigma. And that's because it's often seen as like the individual's responsibility to take care of rather than the societal or systemic issue. Stigma, regardless of if it's food or period products, is often the result of a system or an environment where when somebody asks for help, they're met with judgment or barriers. So stigma is not naturally occurring. I don't believe in individuals. It is a product of what they see around them or what happens when they do ask for help. And when I think about the gaps that exist in these conversations, I think about how people can share their needs and their stories in a transparent and accessible way so that we can be more responsive as providers. So that was just a big
Yeah.
verbal, like processing journey. Thanks for coming along with me on it.
Happy to be in your TED Talk, Jamie. I think like hearing you talk about that, um, I feel like a lot of students are coming and have sort of they had an experience. They had an experience where they needed a product. It was an emergency. Maybe they were having their period for the first time and they were unprepared either in product or in understanding what was happening to them, right? We do not have period care embedded into health education for the most part in the United States. It is required in only a handful of states. And so, what you're dealing with is young individuals who have their period for the first time who think they're dying, who think that they are dying. And so that carries through to your college experience, right? You feel shamed. You feel like it's not a basic, normal biological process. When you did ask for help from a teacher, for example, maybe you were told, or you said you had to go to the bathroom in the middle of a test or in the middle of something, and then you got tisked for not being like you need to go back to your seat or you're not prepared. And so it's those experiences that I think people who are having periods, who need period products, that sort of accumulates over time and leads to that sort of forced stigma, institutionalized stigma, and then not wanting to talk about it and feeling embarrassed just about the process, but also feeling embarrassed that they need a product or can't afford
Mhm.
a product for their household.
The I statements I could make in these storytelling situations.
Yeah,
Jillian,
yeah,
did you
yeah.
want to answer questions as we go, or do you want to wait towards the end?
I think we towards the end, I also I'll be honest, my chat has disappeared on my screen. So Jamie, if there are questions coming in, but if there are ones that come in right now that you'd love to answer, I'm always open to doing that in the chat as well.
I just saw a hand raise, so perhaps that person could put their question in the chat, or we can just ensure to call on Crystal Brown towards the end.
Yeah, that works for me. I also
Awesome.
love this too, this conversation that we're having, and it reminds me of a little sneak peek that I'll do of our town hall that we're hosting next week. Is, we know that this is continues to be a thing. It's in the survey we've done of the 1/3 of our campus partners, we've seen that over 1.7 million basic hygiene products have been distributed in those campus pantries in just this past year alone. So, we know that this is something that is a necessity that students are reaching for, not just food, but these kinds of resources that they're relying on. And I'm loving this conversation and the ways that we can go about this and really address this. And I'll end there for the little sneak peek of the town hall because we always welcome everybody to join us next week with that as well. But I'm just loving this conversation that is occurring.
I guess I'm sorry. I have a lot of feelings about period products, obviously. I think, one baseline, and this is more around around bathrooms. So we'll often talk to people about our dispenser and bathroom distribution. And folks will say, well, why aren't women more prepared? Like, shouldn't they just know? Right. And I get from like a I get from a if you don't have a period, that might seem like a very logical assumption, but it is not a clockwork experience. It is not a predictable experience. And regardless of whether you have oodles and oodles and oodles of money to buy all of the period products you've ever wanted, every person who has a period has had a moment where they are like, oh shoot, I do not have what I need. The richest people do not have products whenever they need them, right? It is not related, there is a different, this is not an income issue. It is a hygiene access issue. And then it is exacerbated when you bring income into the conversation. And so I think, we're really trying to destigmatize and bring normalcy to this product because this is an everybody issue, regardless of what your income is.
I love that, Ellen. That's a great way of putting it. I think that's a natural precursor to our next kind of question. I love when questions always flow kind of and answers flow with one another. So, really, despite it being a universal health need, menstruation is still surrounded by unnecessary social barriers that can prevent students from getting the products they need. How can we work together to dismantle these barriers and ensure every student feels empowered and comfortable accessing products?
I think going back to just, having these conversations, normalizing the conversations, making the products really obvious in your pantries and your basic needs hubs as part of your portfolio, even if you're not offering them, thinking about them as you're on your potential roster of opportunities, calling them out. I'm seeing more and more, and I love this. I'm seeing more and more pantries and food banks and things when they put on their like wish lists, they're actively putting period care on there and calling it out. Because in many cases, it's sort of this hidden thing. It's like, oh, the thing that we don't want to say that we're doing, that we're actually doing. And we actually need these products and we want to provide these products, but we don't want to say that we're doing that. Even if you are not doing it right now, please be vocal about the fact that this is a hygiene product that you might want to consider providing or that you're interested in providing and need support providing. Um, just just making it a part of, it's tampons and toothpaste, super easy. And and really feeling comfortable putting it on those lists and talking back to funders about the needs.
Again, like sorry to get into the narrative change piece, but what we find in food and extends to other basic essentials is there's just such a misconception. There's the stereotype or the inner dialogue that decision makers have where this is just not a priority. And so, how do we change the hearts and minds of decision makers? You can do that through legislation. You can do that through storytelling. You can do that through friend building, is what I call it, right? Find that one program officer at the foundation that feels as energetic as you do about this. Build your group of champions. But when I think about this issue of the systemic misconception, for lack of a better term, that Americans have about periods and the products that folks require is so fascinating to me. Um, I just am going to put this under the heading of get cringy. Get absolutely cringy with it. Talk to people, bring it up. My mother would be so proud of me right now. My mom worked in the medical field and was talking about periods and babies when I was like in kindergarten, right? Like, I mean, like this is when you bring it into your regular conversation spaces, you allow people to make the connection themselves. You allow them to help you in your fundraising, decision making, the lift that it requires to provide these services and products to individuals. Um, so I'm going to end it there. Get cringy.
I love it. I love it. What a fun perspective with it. What a fun way of putting it. And I think that's forever the best way to approach any kind of basic needs insecurity is it's talking about it. It's being cringy with it. And it's talking about that hardship, but also talking about the work and the champions that do exist in the space that ultimately can lead to this narrative change. Because I'm all for putting everybody out of business that does basic needs work because that means that everybody's basic needs are met. That's my life mission. It's a big uptake. I know it's a big, big uptake, but that's the goal ultimately at the end of the day is if all these pieces are in place, that means that we know that every student, every person is feeling empowered with this and comfortable accessing these kinds of products and services when they need it. And it doesn't have to come in emergency at the end of the day. So I love this. I love this. Um, that was the last of my questions, but always happy to welcome any questions in the chat now, anything that comes up. I know, Jamie, you had a few questions kind of stirring in your brain, so we have a few minutes before we move on to the raffle portion of this. So always happy to continue the conversation going.
I think that you've mentioned this in previous swipe sessions. So this isn't a question. Apologies. Let me go on a side quest really quick. Jillian's mentioned this in previous swipe sessions, and so has London, that, seeing is believing. Seeing is inspiration. And so if you haven't yet visited another campus pantry in your area to see how they feature their period products or ask them questions about which relationships they've developed or what has worked well for them, I really do encourage that. And I know that I'm a poor substitute for Emily at Boise State University, but I think this is an area she wouldn't applaud herself for, and so I'll do it for her. That not only has she raised her hand and said, yes, Unicorn would love to partner with you, but she's also looked around her community. She's created this beautiful hygiene corner in what is now a basic needs center and started as a very modest, like, food closet just a couple of years ago. Now is this very gorgeous, like, grocery store format with other basic essentials provided. Again, food is a gateway for many of those. But this corner, this hygiene corner, has numerous shelves where there is attractive signage, information about how to use period products, what's available, what the relationship is between the pantry and, the vendors, what people can expect from this space. And that information, you see people, regardless, again, of their gender identity or, how they are perceived, come up and read it. And whether they need those products or not, that you've made that much more effort and dent in kind of building that awareness. So I do want to applaud Emily and her team for that. My question, we touched on this briefly, and so Ellen, you got to it, is really how you all saw stigma manifesting and what kind of barriers it creates for Unicorn. So yeah, if you have additional thoughts, I'd love to hear them.
Yeah, I think the stigma also, we often say, oh, okay, stepping back. I think a lot about bathrooms. I spent a lot of time in commercial bathrooms. I spent a lot of time taking like pictures of dispensers that are broken in commercial bathrooms. And a lot of times folks are like, oh, this must be really hard work because you're talking to men. Like men, people who identify as male tend to be in the janitorial bathroom commercial space. Right, fine. And a lot of times, once you sort of explain to them that this is a basic biological process happening once a month for many people, and there's inadequate access to products, or there's access to really terrible products that no one would ever want anyone that they love to even use, they're like, oh, well, someone should do something about that. They're like, yes, someone should do something about that. And they're like, well, we should fix this. And they're like, yeah, you should fix this. And so I think there's these sort of aha moments that a lot of people have where they're like, oh, I didn't realize this was an issue. I didn't, they'll often take it back to like their spouse, their children at the dinner table, and they'll give them an earful, right? Because it's just not talked about. And so once they come back and they're like, I just didn't realize I was offering a terrible product or offering no product, it's like this, oh, I can do something about that. And so I wouldn't ever make assumptions about who could be your champion or cheerleader as well, right? In some cases, it's actually the person who you least assume to be a champion or cheerleader or care about this. And I would say, there are so many stories that we get, and it's really heartwarming of parents or adults who say, I watched my mom really struggle, and I watched my mom really struggle to support my sisters, and I don't want anyone to experience that. And so it can be very personal for people in a positive way, in an action oriented way. And so as much as we've talked about shame stigma, there's also a really beautiful narrative around support and encouragement and solution finding, particularly from people who you wouldn't assume to be your greatest champion.
Love that.
Love that. I love that. I love
So
that.
if you see Ellen in a bathroom taking pictures,
Don't get freaked out.
no, you
Yeah,
didn't.
you should see my camera roll is awkward, like broken dispenser. So external resources. So for those of you who are thinking about how to like understand the problem, keep up with what's happening in your state, in your local, there's no federal regulation around period care. So just start there. All hyper local, state based, county based, school based. That can be very difficult for some of you to keep track of. And I get that. So there are these amazing organizations that will do that for you, that will help you with language, that will help you with resources, that will help you find education opportunities. These are sort of my three US based or organizations that are doing US based work. So they're also going to have it through the lens of the United States, which I think is really important. Um, Check out their websites. They're doing amazing work. This week happens to be Period Poverty Awareness Week, which is kind of a mouthful, put on by the Alliance for Period Supplies. So you also might see a lot of social media around them, but these are my sort of gold standard who I go to for language, for tracking, and for just keeping up with what's happening in period care.
I love that. Thank you for sharing all those too, Ellen. And I'll say this too. We did not know when we picked today that it was National Tampon Day or
Yeah.
Period Poverty Awareness Week, but it's perfect timing. What a
Mm-hmm.
great way to discuss it on these important days. Okay. So as promised, we're doing a little raffle for as a thank you for being with us today, courtesy of Unicorn. So thank you so much, Unicorn, for doing this. As a token of appreciation, we're going to select randomly one winner during the session. So I'm going to start this little timer for the next minute or so. So just share your campus theme in the chat. We'll select a winner afterwards. Since we have your registered email associated with this, we'll reach out to you afterwards. We'll announce it today, but two winners will get selected. So one right now, one later this week, and we'll follow up with you about ways we can get you those bulk donations. So I'm gonna have that little timer. I should have added like Jeopardy music as a part of this because that's always
I'll
fun.
sing, sure. No, no need to ask. No need to pressure me. I'll just sing a tune for you.
I
Just
love
kidding.
it.
Oh, please, God.
So,
No, I'm just kidding.
I know so many of your schools and also like hi Lucy in Rhode Island, Michigan State. I grew up in Michigan. It's great. It's awesome to see everyone from everywhere.
I
Um,
love it.
yeah. So I can tell you more about the bulk product. So we have
Yeah,
two
that'd be
main bulk
perfect.
products that are really used by what we call our community serving organizations. So we don't have any gatekeeping around being a 501(c)(3) or being a school. We work with food banks that are ginormous, and we work with individual Girl Scouts or people at a faith-based organization that really care about this product. And so think big cases, 1,200 day pads or 1,600 tampons. So it's high impact. It's awesome. Everyone wants 1,200 day pads in a case.
I love it. I love it. Okay. So
So
thank
how do you
y'all.
choose? How
We
does
were
this
gonna we're gonna put him in a random generator. And
work?
it's just gonna we're gonna put all the names together and put it in a random generator. Although let's see if it lets me do that. I might have to pause the presentation for a moment and do that, but I'll continue on really quickly and then I can do that in the background for a moment. We also wanted to highlight too, Unicorn has graciously started offering now a discount code for our Swipe Out Hunger network. as this will be posted on our channel, we wanted to share those discount codes afterwards. So if you're interested, we will also be sharing out those discount codes. We have a first time discount code and then a reoccurring discount code that Unicorn is offering. And if you're wondering what this discount code can do for you, feel free to snag the QR code right now and we'll be able to go ahead and do so. And so I'm just gonna continue on and then get that generator going in a moment. For any of us who are not a campus partner but are interested in joining, you can use this QR code, a lot of QR codes this session, to join our network. We have a lot of different great opportunities that involve being a part of our network, including additional discount codes to Unicorn, Pantry, Matriarch, and a whole bunch of others. We also have organizations that do appliance donations, such as fridges and freezers, directly to your campus at no cost to you guys to come and install. It's fantastic. And then access to our SWIPE grant program as well. So each year, SWIPE awards about $400,000 in flexible grants to our partners, allowing you to allocate funds where you need it most. So if you're interested, feel free to snag that QR code as well there too. And then, as I mentioned earlier, we are also having our town hall next week. Greater impact, fewer resources. We're going through our campus leader survey results that goes through and shows all the different data collection that our campus network is directly seeing and the different ways that we are seeing in addressing food insecurity and college hunger across the United States. So I also encourage everybody to go ahead and do that as well. If you're interested, it's next Wednesday, 3 to 4 p.m. Eastern, 12 to 1 p.m. Pacific time. And then ultimately, thank you for attending. So I'm going to stop sharing for a moment and then
While
get,
you do the generator, let me chat to the posse that's here, if you don't mind.
I love it. Go ahead,
Okay.
Jamie.
Soft shoe for you. So while Jillian does the more important thing, which is get the randomly selected winner of the products from Unicorn. Thank you again, Unicorn. So generous. Like Ellen mentioned, we're in year 5. We're going into year 5 of our partnership. Yeah,
Yeah.
incredible.
Yeah, we started when you
Fun.
all acquired the CUFBA, the Community and University, no, College and
College,
University Food Bank Association.
incredible.
Yeah,
Dang,
I know, I know.
it's wild. What a journey. Um, Part of the information that we collect, Jillian mentioned our swipe grants and the discounts from generous folks like Unicorn that we have available through our partnership. The only real requirement we have is filling out the campus leader survey, and that's what's informing our town hall next week. So I just wanted to put in a shameless plug of the importance of that data. It really helps us share back information to Unicorn, our other corporate sponsors of just sharing like this is what the state of hunger and basic essential access looks like in our country. And your data is really super important. And I know a lot of you are changing the way you do intake or, the products that you're carrying dependent on funding. And so really helps us tailor our conversations in these swipe sessions, our strategies, our programs and initiatives throughout the year so that we can be as agile as you are. So I just wanted to put in a plug for that while Jillian is doing some mathing, it looks like she's counting.
And I don't know I've never taken your survey because I'm obviously not a campus pantry leader. But in terms of period care, what we don't talk about doesn't get addressed, right? And so if you are
Exactly.
not talking about period care, even if you are not offering it, just the awareness that this should be a part of the conversation is really, really, really important. So you all have such valuable roles, regardless of if you are able to offer period care at this time.
Love that, Ellen. Ellen, it's like if we're not going to change the things that we don't measure, right? It's kind of like in that same vein. And if you're not offering, why, right? Like help us better understand and tailor again our messaging and our services to support you getting into that next phase. Love that.
Yeah. And I think a lot from nurse surveys, and they'll often say, well, kids just aren't coming to us. We don't know, like there isn't a need. And then you look at the number of free and reduced kids in their school, and you look at all of the utilization of other services, and you're like, this just doesn't match, right? But because they're not asking, if the need is there and because folks don't feel comfortable, it just looks like this hidden thing that is miraculously being addressed out in the universe. So,
Therefore, it's solved.
yeah, yeah.
So I have a winner using the random wheel
Boop-a-doo-doo.
generator, putting everybody's gift the same in. Heritage University, you are the first bulk purchase winner for this swipe session. So thank you so much for in
Thank you.
attendance. Um, so Claire will be in contact afterwards. But like I said, we're also raffling off another one. So I'm gonna redo it afterwards with everybody's information in there. And we'll be following up afterwards to with both the discount code and the slides, all of this. So thank you so much, everybody, for joining us today. Thank you for this important discussion, and thank you so much to our amazing panelists. And what a great conversation we had around period products. Thank you, everybody. I hope the end of your semester is also really amazing. Congratulations to any students that are graduating also this weekend that might be attending the swipe session today. So thank you all. Have a wonderful, wonderful, wonderful rest of your week. And hopefully we'll see you guys next week at our town hall as well.